I'll tell you, I think we're in really dangerous times. I think it's going to get very dangerous. I think we have a socialism coming into our country that's unstoppable. I think they're trying to take over 25% of, and I say they, and I don't necessarily mean Obama, but I'm just saying that they are trying to take over 25% of our national economy. $23.7 trillion has escaped our country. I think this healthcare thing is just a smokescreen for control of people. And I think it's going to continue on and on and on until the American people do stand up. I don't mean to take too much time, but a couple weeks ago I had some people come all the way from Monroe to talk to me about this healthcare plan. And they wanted to start emailing and writing letters and doing petitions. I told them, no, you got to confront your congressman. It won't work because they don't listen, because during the stimulus package they had 58,000 phone calls to one against it, and it still went through Congress. So, I mean, I truly believe in all this stuff right here, and I would tell people that, you know, you need to get educated. You need to really read what's going on in our country and really take a good, deep look, because it's coming someplace from the back here, because like you said, we've been asleep for so many years. My grandparents, my parents, and even I've been asleep. I'm only 51, and I'm waking up, and I'm going to say, no, enough's enough. So.
My concern as a baby boomer is going to get on Medicare in 2012. 2011, the first baby boomers are going to be heading for Medicare, the largest generation in the history of the United States. And all of these bills, every one of them in the Senate and the one in the House, plan to cut $500 billion from Medicare. At the same time, the largest generation is going on Medicare. And to say that they're not going to ration stretches the imagination. And how they're going to cut those without rationing, it really doesn't pass the smell test. Senator Dodd had prostate surgery. He's 65 years old. He's under the congressional plan. He gets everything paid for by us, the taxpayer. When I'm 65, if I have to have prostate surgery, I hope that people running Medicare won't say that I'm too old to get surgery and just tell me to go take hormones for 10 years and then die a painful death of cancer. The other thing I have to say is, if this public option is so great, then why is Congress specifically exempted from going to the public option? Why will they keep taxpayer-funded premium health care for themselves?
There's some people, not ones in this room, obviously, but who think that this bill really is not that serious. First, it's not really through the Senate yet. It's just version from the House. It's not on the president's, you know, we're supposed to, so the alternative is we're supposed to wait until it is all the way through, and then we're supposed to look into it and talk about it and speak up against it. The time is now. The time is now. They're trying to take control, and they do it, and if they can't do it the way they want it now, they'll settle for little by little. We have to stop that as well. When they get the foot in the door, that opens it to the rest. When you've got the government firing the CEO of GM, when you've got him telling what the new one, who the new one will be, and how much he will make, I mean, that's a step right there that should tell you an awful lot about what's the philosophy behind all of this stuff that's going on. So let's not wait till it gets to you. Let's see what's going on with what they're proposing now, and let's get it out now so that they don't do this. And then maybe they won't try to attach it to other bills later on. And let's keep paying attention to make sure that they don't, because that is always a possibility. So let's keep our eyes and ears open, and let's keep speaking against this, whether everything that applies to you or not, it applies to plenty of others.
I get tired of hearing people talking about greedy doctors, the same as I got tired of people talking about greedy oil companies and greedy insurance companies. Our country is based on the ability of freedom to work as hard as we want, as long as we want, and make as much as we want, and nobody can tell us that it's wrong to be a millionaire or a billionaire. my husband and I are a lot better off than my parents and than his parents were, because we work not harder, but things are so much better now than they used to be. And the health care, we have a wonderful health care system. It might need some changing, but our government doesn't need to do it.
My name is Devin Stevens. I live in Palmyra Township. And as a 15-year-old and the youngest person in this room, I am the next generation. Many people have talked tonight about how this health care bill is just another way for the government to take control. It's also another way for them to dig us into so much debt. And like I said, as a member of the next generation, I don't want to have to pay it off. How am I and my kids and their kids and the kids to follow, why should we be responsible to pay off what the people in Washington are doing now? That's not our responsibility, and I as a 15-year-old have no say in what they're doing, but yet they don't realize that it's going to have to be paid off eventually.
You are seeing special interest group money. You are seeing the large institutions, healthcare institutions' money at work. You're not seeing what the wishes are of everyone in this room. And the only way to change that is for people to get involved, for you to hold your legislators accountable for the choices that they make and make sure they're speaking the will of who's elected them. Thanks.
Insurance. It's scary. You suddenly, after 20, 30 years, have no insurance. So what are your options? $1,200 a month for COBRA if you have kids that you have to insure. Or you take a job you don't like, and then if you lose that job, you're out. A friend of mine, husband worked the same company 25 years, he's out. They have 2 kids, no insurance. Something has to be done. It doesn't work the way it is right now. People should not live in this country without basic medical care. They should not have to go to the emergency room for a sore throat. They should not have to go to the emergency room because they have some simple condition that should be treated by a doctor. Maybe the plan they have out now isn't the right plan, but people in America have the right to health insurance. Everyone should be able to go through it.
Because I'm hearing things that just don't make any sense. I hear this poor lady's got a nephew who's been incapacitated by some malpractice issue, and you're bragging about limiting that family's right to receive compensation for medical malpractice. You think this is a good thing? I hear people talking about, it was the first thing you said.
I did, the whole group saw it.
I said it doesn't make any sense.
I said limiting frivolous lawsuits. That's what I said. And I also said there are lawsuits that
can be applied to anything and misrepresented.
Oh, no, let him speak.
Well, that's an enlightening view. All these Medicaid recipients out here are talking about how awful it is to have a government-run program, and yet they're
We have reform without total government takeover of our healthcare industry. And I attended what I thought was going to be a town hall meeting last Thursday at Mark Schauer's office, and we were shouted down, called brown shirts, and pushed out of the way so that we didn't have the opportunity to speak to Mark Schauer by people wearing union t-shirts.